Good morning. Hard work never brings fatigue, it brings satisfaction. It is one of the inspiring quote by our Honorable Prime Minister Narendra Modi ji. Continuing with the next topic. The next topic is about human immunodeficiency virus, that is the HIV virus, which is from that of the topic of microbiology. The basic contents would include the human immunodeficiency virus, that is HIV virus, the introduction, the classification, the morphology, the antigenic structure, the mode of transmission, the clinical features, the opportunistic infection caused by it, the oral manifestations, the lab diagnosis, and the prevention with the prophylaxis and the treatment, that is the antiretroviral therapy with the universal measures to prevent HIV. So this opportunity I take by the request of many of my friends and family members. I have tried a somewhat different kinds of PPT this time. So let's see what's the new thing. So coming to the introduction would include it's an RNA virus belonging to the Retroviridae family, and it has a special enzyme known as the reverse transcriptase enzyme. The classification would include the HIV is divided into two, that is HIV1 and the HIV2. In coming to the next one, the morphology. The morphology includes it's a spherical virus which is covered with the help of an envelope, and that is why it's an enveloped virus, and it has a copy of double-stranded RNA which is approximately 90 to 120 nanometer, and also it has a spike present on the surface. Coming to the next topic, that is the antigenic structure. In the antigenic structure, we can see it has several parts, that is the envelope GP20 protein, the envelope GP41, and then we have the GAG P17 and also the GAG P24 which is present. Coming to the double-stranded copy of RNA, and also it has an envelope which is the outermost coating and the matrix layer and the capsid which is present. And in the last, the presence of the special enzyme, that is a reverse transcriptase enzyme, and this is the constituent of the human immunodeficiency virus. In the next, the mode of transmission. So there are totally three modes of transmission, in which the first one is sexual contact, which is most common mode, which is seen both in homosexual and heterosexual. The second one is parenteral route of transmission, which includes the blood transfusion syringe exchange and also IV drug abusers. The last one is perinatal transmission, and the perinatal transmission is transfer from mother to the child, that is the vertical transmission. The next heading will include the clinical features. So what is this clinical features? The clinical features will include the group 1, which is including the acute HIV infection, which is characterized by fever, malaise, myalgia, and etc. The second group would include the asymptomatic infection, which includes all people who are even well to and they are positive for HIV antibody test. The third group in the clinical features would include the presence of generalized lymphadenopathy, usually enlarged lymph nodes. The fourth group would include the symptomatic HIV infection CD4 T plus lymphocyte cell count, and which lowers to approximately 400 cubic millimeter, and also the patient shows symptoms of HIV in the last group. Coming to the next one, that is the opportunistic infections caused. There are totally 5 types of opportunistic infection caused, which are: the first one would include bacterial. The bacterial includes the Mycobacterium tuberculosis and the M. avium complex or the Mycobacterium avium complex. The second one would include the viral one. So the viral would include the cytomegalovirus, that is the CMV, varicella zoster virus, that is the VZV, herpes simplex virus, that is HSV, and the Epstein-Barr virus, that is the EBV. The next one is including the mycotic infections, and the mycotic infections are candidiasis, cryptococcosis, aspergillosis, and histoplasmosis. The next one would include the parasitic infection. The parasitic infection is toxoplasmosis, cryptosporidiosis, and isosporidiosis. The last one would be that of the malignancies. The malignancies include the non-Hodgkin's lymphoma, that is the NHL, and the Kaposi sarcoma. Coming to the next one, the oral manifestation. The first oral manifestation is dental caries, which is caused usually. The second one is gingivitis. The third one would include the oral hairy leukoplakia, that is a hair-like appearance. The fourth one is oral candidiasis, and the fifth one is the angular cheilitis, and the last one is mouth ulcerations. So the main 6 points are dental caries, gingivitis, oral hairy leukoplakia, oral candidiasis, angular cheilitis, and the mouth ulcerations. Coming to the next heading, that is a laboratory diagnosis. In general, the laboratory diagnosis is divided into two. The first one would be specific HIV test, and the second one is non-specific HIV test. Under the specific HIV test, the first one is antigen detection. So the antigen is detected with the help of ELISA test, and it is usually done during that of the window period. So what is this window period? This window period is nothing but the clinical bacilli entering the body and the appearance of the infection. The region between these two gaps is known as the window period. The next one is virus isolation, which is done with the help of done with the help of the CD4 plus T cell count, and it is again used to diagnose during that of the window period. The next one is the detection of viral nucleic acid, and the viral nucleic acid is detected for the detection of viral nucleic acid is detected with the help of the test known as the PCR, that is a polymerase chain reaction, and again this is the test which is used to diagnose during the window period. The next one is the antibody detection. So this antibody detection is again further divided into two. The first one would be the screening test, which would include the two headings under it, that is the ELISA and the rapid test. The second one would be the supplemental test. So what the two tests which includes the supplemental test are the radio immunoassay and the immunofluorescence test. Coming under the non-specific test, under the non-specific test, the next one would be include total differential leukocyte, include the total and the differential leukocyte count. So in total, the lab diagnosis of the HIV is divided into two. That is the specific and non-specific HIV test, under which the specific is again divided into four. That is antigen detection, virus isolation, detection of viral nucleic acid, and the antigen detection, antibody detection test. Coming to the next heading, that is a prevention. So how would you prevent it? The prevention is done with the help of using the barrier method, and the second one is prevent the sharing of needles, and which leads to blood and blood contamination products. The next one would be isolate the individual and also the person with HIV who is at a higher risk, and the last one would include that of the prevent contamination of blood and blood products. So these are the four preventive measures: usage of barrier methods, prevent sharing of syringe, then next one is isolate the individual and also the person at higher risk, and prevent the contamination of blood and blood products. Coming to the next one, that is the treatment. The treatment is done by two methods. The first one would be the HAART therapy, and the second one would be that of the antiretroviral therapy. So there are some universal measures and precautionary measures which is done. So the first one would include the hand wash principle. The second one was is by having an appropriate garments while entering the lab, like that of the lab coats. And the third one would be wearing the mask. The fourth one would be using of hand pipetting instead of mouth pipetting, which may lead to some blood contaminations. The next one would be social distancing, and the next one, the last one, would be sterilization and disinfection of the laboratory and the stuffs which we use regularly. So these are the five general precautionary universal measures. That is the hand hygiene, the use of appropriate aprons and lab coats, the mouth mask, and the hand pipetting instead of mouth pipetting, and social distancing, and also with sterilization and appropriate disinfection procedures. So yeah, just to revise the end, the introduction would include it's an RNA virus, which is a retrovirus family which possesses a reverse transcriptase enzyme. The next one would be the classification, that is HIV1 and HIV2. The morphology would be spherical envelope virus, 90 to 120 nanometer circular double stranded RNA, and reverse transcriptase is the enzyme, and the spikes is present on the surface. The next one would be the antigenic structure, which contains RNA, glycoprotein envelope, the nucleocapsid, the reverse transcriptase enzyme. The next one would be the clinical features, that is divided into group 1 to group 4. And the opportunistic infection would include the 5 types, that is the bacterial, viral, mycotic, parasitic, and the malignancies. And the next page, that is coming to the oral manifestation, that is the dental caries, gingivitis, acute necrotizing ulcerative gingivitis, oral thrush, oral hairy leukoplakia, all these would be under it. The next one would be lab diagnosis, which is done by specific HIV test and non-specific HIV test. And the last one, that is the prevention. The prevention can be done by barrier methods, prevent sharing of needles, isolate the AIDS patient, control infection by rapid testing, and etc. The prophylaxis is done by is actually nothing much, because the because the virus mutates very easily. So that is why the prophylaxis is very difficult in this case. And the antiretroviral therapy will include that of the HAART therapy, and also drugs like zidovudine can be used. And in the last, the universal precautionary measures, that is usage of mask, safety wears while lab work, hand pipetting done in lab instead of mouth pipetting, wear of lab coats, wash hands regularly. So yeah, this was just a small simple presentation for that of the AIDS. So yeah, if you would like my class, please do like, share, subscribe, and share with your friends. Hope I continue with this kind of entertaining PPT and simple ones, so that you could enjoy it more. Thank you once again.